Hello guys, today we're going to talk about lateral epicondylosis, which is commonly known as tennis elbow. And tennis elbow is the most common tendinopathies where the pain arises from origin of extensor carpi radialis brevis. Sometimes the similar feature may present with sudden traumatic onset, but this is suggestive of acute tendon rupture that often requires surgical repair. Now the clinical features of the tennis elbow is person is usually of age 40 to 55 and they present with a pain on the lateral part of the elbow, and pain are usually gradual in onset. Sometimes pain can radiate from the lateral epicondyle to down to the forearm, and person present with a typical history of pain that aggravates on lifting the loads, and elbow usually looks normal but slight swelling may be visible. There is always a full range of movement of the elbow which may be absent in other conditions of elbow. On examination, we found tenderness on palpation over the front of lateral epicondyle, which is a part of origin of extensor carpi radialis brevis, and the Cousins test, which is most commonly done test in the OPD for the diagnosis of the tennis elbow. There is a painful resisted extension of the wrist cause pain over the lateral epicondyle. There are other tests like Maudsley test where the pain on resisted middle finger extension, and Mills sign where there is a resisted elbow extension in pronation with flexed wrist cause pain over the lateral epicondyle. The diagnosis, and most commonly the diagnosis of the tennis elbow, is done only by the clinical feature and examination, and X-ray, USC, MRI like investigations are not required, but sometimes X-ray may be required if there is a history of trauma or extreme of age, and USC, MRI are usually confirmatory diagnosis. On treatment, for knowing the natural history of tennis elbow, usually spontaneous resolution of the pain occurs in 12 months in 90% of the cases. And most commonly done management is non-operative, where there is activity modification being the most important one, where we identify the factor that cause pain, and avoidance of those precipitating factors is really important. And physiotherapy, where we do a forearm extension stretching exercises. Static wrist splint and tennis elbow splint are commonly used for the management, where the tennis elbow splint compresses the extensor carpi radialis muscles just distal to its origin, which reduces the stress over its origin that is present in the lateral epicondyle. Other method can be steroid injection, but the steroid injection as short-term pain relief is really good, but recurrence rate are high and the elbow is more likely to be painful in the long term. An autologous blood product injection may also have a role according to the recent researchers. Operative management is not required in the most of the cases, but if the pain persists despite of adequate non-operative management, sometimes tendon debridement may be required, which can be done either by open method or by arthroscopic method. And this is how we conclude the tennis elbow, and I guess it was helpful.